with my fellow cohort and the professor of the class. I went to school many years ago for a pre-medical curriculum and became a doctor of chiropractic in 1982. I became a professor at Palmer College in 2010 and then decided to expand into nursing as well. So I became an RN and got my AA in 2014, my BSN in 2016, and then I matriculated with all of you to do this FNP program. I have published approximately 13 publications in peer-reviewed literature, so I do have some experience in this area, including a triple-blinded randomized controlled trials, and I have contributed to 2 textbooks. I currently spend about 30% of my professional time as an expert witness for trials, hearings, and regulatory guideline groups. Not bore you, but I'm extremely proud of my family for many reasons. They're all very loving. I just adore them, and it's I have a heck of a time, and I always learn a lot when we get together because of the varied education. If you look from left to right, my son-in-law is a software engineer. My daughter next to him is an industrial engineer. My daughter-in-law, seen here, is an electrical engineer. She got her PhD at 25 years old. In the middle is my son, who his PhD is in statistical modeling. So if I need a mentor for this class, it's good to have him, and also in research methodology from USC in Los Angeles, California. Next to him, of course, is my lovely wife, who was a mechanical engineer and worked in nuclear and a doctor of chiropractic before she retired. And then there's my mug. Next to me on the right is my other daughter-in-law, who's a wonderful teacher and marketing specialist. And on the far right is my other son, who's actually a twin brother of my son in the middle there, who has been an attorney for about 7 years. He's house counsel for Closing.Corp. So it's wonderful to have all these mentors in the family. I very much appreciate that. My interest is really, how does one synthesize results from highly regarded guidelines into a patient-specific individual that we are taking care of in our office? We know that respected guidelines can differ significantly at times, and when this occurs, which guideline do we apply to one patient as opposed to another? Perhaps applying additional criteria to guideline choice, such as age, sex, chronicity of condition, likelihood of compliance, etc., can provide the advanced practice nurse with a way to help resolve this battling guideline issue. So that's something that I'd like to study to see if we can come up with some criteria that would help us in making better decisions for the individual, since guidelines are really for the masses, if you will, with a specific diagnosis. Where I developed and carry out our current 4-core system. So we provide numerous and varied services under the direction of our family practice physician, Dr. Kempred. I practice there as a provider and co-developer in most patient programs, and the FNP certification would allow me to provide a larger portion of the primary care portion of our practice without having to have the direct supervision of our physician. So patient treatment plans are guided by the patient, their desires, as they choose service options from our 4-core system. They read a brochure that we give them that talks about the 4 cores, and then they can decide what it is they want. We don't try to ever offer them services that they're not interested in, but we do our best to make sure that we give them everything available that will make them happier and healthier. So the first thing is relief. If they have a symptom of back pain, or if they have a condition such as hypertension, things like that, we will address the problem, reduce the pain if it's a painful condition. And we'll provide, if it's a spinal problem, for example, we'll provide all kinds of interdisciplinary treatment available depending on their particular needs. So we might provide spinal adjustments in chronic recalcitrant cases. We might recommend trigger point injections. It might be simple medication or instruction, ice packs. It just depends on what their specific needs are. And we'll recommend supplementation, nutritional supplementation, such as vitamin D3, which helps with pain management. The epidemic that we have, we provide a doctor-supervised weight loss program We also provide bioidentical hormone replacement therapy, which 90% of what we do really is supplementation of testosterone for men and management of postmenopausal symptoms with estrogen or progesterone, depending on the specific needs of the patient and what's appropriate. We will try to give patients lifestyle changes they will actually stick to so that they can live a healthier, happier life. We'll develop programs that help reduce their risk of developing heart disease, cancer, diabetes, things that are known to help with these things, such as appropriate exercise programs, dietary changes, etc. And then we provide acoustic compression treatment for erectile dysfunction, and we also provide it for neuromusculoskeletal conditions. There's a good deal of evidence on that particular type of sound therapy. They look younger and feel better about themselves, so we do provide some cosmetic help with that. We call them rewind programs, where we'll assess them and make a recommendation of neuromodulators, fillers, Kybella, things like that. We don't go all out with it. We're just trying to turn the clock back a little bit so that we don't change them, but we make them feel a little better when they look in the mirror and they're happier with what they see. For cellulite programs, we use acoustic compression for that, and we do have a nutritional coach that monitors all weight loss programs. They can choose one or all of these concepts. If they want pain relief, great. If they want to reduce their chances of diseases with dietary programs, nutritional programs, exercise programs, we're happy to go there. But we want them to feel, function, and look better than ever with the specific approaches that we want and the ones that they're interested in. So we're hoping that it helps them live a longer, healthier life and significantly reduce their chances of developing disease. I am, and I look forward to having access to your videos to learn a little bit about you. If you need to contact me for any reason or you want to discuss anything that I talked about here, always feel free to call me or email me. My contact information, my cell phone number is on the screen. It's 510-913-1366. And the best email to reach me at is cremata, CREMATA, @gmail.com. Thanks, and I look forward to taking this course with you.